What's going on, everyone? Happy Sunday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Sunday edition of the Pandemic Update for Sunday, February 25th, 2024. If you're new to my channel, this is where we do the daily pandemic on, yes, COVID and any other virus that could be a threat to you. If it's a virus that could spread, we talk about it. If you want to help keep yourself informed or others informed, give this video a thumbs up. The more likes we get down below, the more they push our content through the algorithm, and the more that helps keep people safe because more people get to see our content. If you want to stay informed, you could also subscribe down below and, of course, share this with anyone you know and all over social media. All right, we have a ton of things to talk about today. If you were watching yesterday, I said I wasn't certain if I was going to do an update. Well, I've put enough stuff together here that I think this is going to be a 15 to 20 minute update today. You know, some people like longer updates. I think this will be one of them. First off, we're going to go through some news. Then we're going to talk about how measles spreads. I've pulled up some CDC and NHS data. It also talks about the symptoms of measles as well. Then we have to look at my website. Haven't shown that on a video in a while. And then we're going to go over some CDC data, wastewater, and a little bit of a review of what has happened in the last week throughout this video. All right, starting off today. Norovirus identified as potential cause of gastrointestinal illness at Liberty University. This is in Virginia. Testing shows norovirus as the potential cause of illness. Liberty University is continuing to work with the Virginia Department of Health, and their community has been asked to complete a survey by the Virginia Department of Health. All right, we have talked many different times or shown many different stories since the beginning of these pandemic updates way back in, when was that, 2022, summer of 2022? Yeah, many different times when we started adding on news later into the updates, maybe about 6 months later. Pope Francis has entered the news several times for being ill. Apparently he was ill yet again yesterday. Now, I'm concerned about Pope Francis. It says here he had a flu-like condition. I'm concerned. He constantly keeps getting ill. I don't know, is his immune system worn down? I know he's getting up there in age. He's 87 years old. But it's concerning to see the Pope constantly getting ill. Hopefully he's feeling better today. It's saying that he was back doing his normal routine for Sunday, so I don't know. I'm just concerned about it. Then we come over to this. In Ghana, in 2023, recorded 19,000 tuberculosis cases. So that's a lot of tuberculosis cases. That's a huge increase over the 16,500 cases of tuberculosis in 2022 and the previous years. So yeah, they got a problem going on there with that. Then we come over to this. This comes to Ireland, and it says here the first person to die of measles in Ireland in over 20 years has been named as popular bus driver Pat Gorman. So yes, Ireland. We've been talking about measles a lot lately, and now Ireland has a measles death, which is not a good thing to see. I think this may be the first measles death that we have seen since all this measles outbreaks have started back late last year. So I thought, well, let's take a look here at the CDC. We'll have to take a look at CDC and NHS to see just how does measles spread. Well, first off here, it says here for symptoms, it says 7 to 14 days after a measles infection, first symptoms show. Measles isn't just a little rash. Measles can be dangerous, especially for babies and young children. Measles typically begins with high fever, may spike to more than 104 degrees. Yikes, that's a really high fever. Cough, runny nose, red watery eyes. Then it says measles is serious. Measles can be dangerous, especially for babies and young children. Call your healthcare provider immediately if you think you or your child have been exposed to measles. 2 to 3 days after symptoms begin, colic spots begin to show. Tiny white spots may appear inside the mouth. 2 or 3 days after symptoms begin. Looks like they may be trying to show it here on the picture on the right. 3 to 5 days after symptoms begin, measles rash. Yes, measles is known for having a rash. 3 to 5 days after symptoms begin, a rash breaks out. It usually begins as a flat red spots that appear on the face at the hairline and spread downward to the neck, trunk, arms, legs, and feet. Small raised bumps may also appear on top of the flat red spots. Then it says the spots may become joined together as they spread from the head to the rest of the body. When the rash appears, a person's fever may spike to more than 104 degrees Fahrenheit. Yikes, that's not good. Now let's come over to this. This is also symptoms of measles. Tiredness, irritability, and a general lack of energy, loss of appetite, aches and pains, small grayish white spots in the mouth, as we just talked about, fever over 104, swollen eyes, watery eyes. You get the idea here, and then we come over to this here, how measles spreads. Measles is a highly contagious virus that lives in the nose and throat mucus of an infected person. It can spread to others through coughing and sneezing. If other people breathe the contaminated air or touch the infected surface, then touch their eyes, nose, or mouths, they can become infected. Remember that. If you're out and about, say you're in a grocery store, you're, picking through the berries in the produce section, or you're taking a look at that perfect apple. Hey, take a look. Or, you got to grab a bag, don't you? You pull down a bag to put your produce in a bag, or whatever. You're going to the meat department, you're going to the canned food aisle, whatever aisle it is. Just keep mindful if you're touching things. Don't touch your eyes, don't touch your nose or your mouth. You want to wash your hands when you're done as much as possible. Hand sanitizer does not always prevent a measles case. I've seen several reports now saying hand sanitizer, that's not good enough. You need to wash your hands for a full 20 seconds. Saying happy birthday. It may sound silly. You may think, this is stupid. I'm not going to do that. I know that, but hey, measles, it's one of the ways that it can spread. Let's continue to read here. Measles is one of the most contagious diseases. This is why we're kind of taking this so seriously, but you're probably thinking, well, wait a second. Why are you taking that so seriously and not COVID? Yeah, it questions me as well, because measles was one of the most contagious viruses. Then along came 2020, COVID. Okay, COVID existed. Then 2021. Delta, and then 2021 and 2022 came Omicron, and well, now we have one of the most contagious viruses ever being COVID. But hey, measles is really contagious as well, and for some reason, it's raising more alarms than it is for COVID at the moment. But hey, it is what it is, and part of it is because, well, COVID's wearing down our immune systems. During the start of COVID, people were not taking the vaccine for measles. There's a lot of different reasons as to why this is serious. Measles is so contagious that if one person has it, up to 90% of the people close to that person who are not immune will also become infected, which is why I said yesterday it's totally ridiculous that the state of Florida, their Surgeon General, is not taking this seriously. He is just, it really gets me upset that he doesn't take this seriously. All right. We've added some things to the website over the past week. We've talked about the measles outbreak. We talked about the measles in Florida. Then we come down here. Hey, this past week you may recall this story. Philadelphia health officials warn some Richmond elementary students may have been exposed to Mpox. Yes, Mpox is still an issue. Then Gabby Douglas tested positive for COVID this past week. She's an American artistic gymnast. And yes, she did test positive for COVID, and she had to miss the Winter Cup. There were also several other things that were added onto my website this week as well, which were all not good news. Mumps. India. 6,000 plus cases of mumps have been reported in India. Yeah, that's not good. Ireland, we learned of the first case this week, and now we're just learning that Ireland had a case of measles where someone had died. And Iowa this week, if you may recall this as well. Back in Iowa, they had nearly 25% of Iowans who have had COVID are now dealing with long COVID symptoms. I'm going to be doing some maintenance to the website, I think, this afternoon. You may notice a few different things. The website, by the way, datareport.info, it's a wealth of information. We have COVID papers and studies. We have the COVID positive archive of people who have tested positive. Still have to finish sorting out these COVID positives. One day I'll get to it. We have a COVID outbreak archive. Have not reported on any COVID outbreaks this week. I'm sure they're happening. We're just not hearing about them in the news. And then, of course, we talk about other viruses. And in here, there's one section in particular that I'm going to be adding just for animals. I want to split up humans and animals. And then, of course, back in the COVID archives, we have the studies and papers. I think it's time that we add a diabetes section. There's been a lot of information coming out about diabetes. In case you did not know, newsflash. Whether you already have diabetes or if you don't have diabetes, COVID, it's not a good thing, not a good combination. COVID can cause diabetes, and it can also make diabetes worse. So, yeah, just another one of the many reasons to avoid the COVID virus. All right, that's datareport.info. That's my website. Now let's take a look at today's air quality across the United States, and you will see it's not terrible. Yes, there's some moderate air quality concerns across the Great Lakes. Today is probably going to be one of the better days. There's going to be some warm air coming up from the south, and with that, I think we're going to see some increased air quality issues probably through to about Wednesday. I don't know if it'll include Thursday. The West Coast, wow, a lot of red in California today. Bad day. It's fireplace season. There's also a flow coming off the Pacific Ocean. I don't know if that's influencing it, but it's not good. And also, I should note this. Look right around the Gulf Coast, New Orleans. You got some bad air quality today. Not certain what's going on there right now. That's not a good thing. If you want to learn more about the weather, I got a channel where I do just that. It's called Climate Data Report. There'll be a link to that down below. I think we're going to do a weather update this afternoon. I don't know. Check out that channel if you want to learn more about that. Philadelphia yesterday had 738 EMS incidents. It's remaining stable. It's been between 700 and 750 for the majority of the week. Taking a live look in at the call volume in Montgomery County, and we've been seeing a lot of this lately. A lot of respiratory emergencies. In fact, for Sunday morning, it's been fairly busy, and I'm seeing stroke. I'm also seeing, oh, this is not good. Ambler, Pennsylvania, cardiac arrest right now. Yikes. Never like seeing that call. And Chester County, Pennsylvania, is also seeing, look at this, respiratory emergency, stroke, sick person, heart problems, injured person. Yeah, there's definitely some calls to be had in the suburbs of Philadelphia right now. Remember, if you want to see me report on more CADs across the country, just let me know if there are any CADs that have public real-time information on the EMS calls in your area, and I'll gladly report on it. All right, let's take a look at some hospital data now. Across the United States, 76.6% of all beds are currently in use, 2.5% are for COVID, 1.1% is for influenza, and in the ICU, which that is calculated separately, 72% of all patients beds for ICU are being used, 2.3% for COVID, 1.3% for influenza. Let's take a look at a few states, starting with Connecticut. We'll see what's going on there. Connecticut, 72.6% of all beds are in use, 2.4% for COVID, 1.3% for influenza. How about the ICU usage in Connecticut? Where is that at? Well, that's 71%, 2.1% for COVID, 1.3% for influenza. Let's do another state now. How about we take a look at Vermont? I'm curious what's going on in Vermont. Vermont, 72% of all beds are being used, 1.9% for COVID, 1% for influenza. And how about their ICU usage? That's going pretty well. ICU usage is only at 61.7%, 1.3% for COVID, 0.6% for influenza. And how about we go somewhere out west now? California. Your usage today is 68.6% of all ICU beds being used, 1.8% for COVID, 0.4% for influenza. Inpatient bed usage is at 78.3%. COVID-19, 2.5% of that, and influenza just 0.5% at this time. How about the great state of Washington? What is going on there? Inpatient bed usage, 85.6%. Yikes, you're using quite a bit of your hospital capacity at this time. 2.8% is for COVID, 0.7% is for influenza. How about your ICU usage? How's that doing? And it went up a little bit. 79%. 2.1% is for COVID, 0.7% is for influenza. And how about we do somewhere like a central state at this time? What is going on in Illinois? I don't know. Did we do Illinois yesterday? Well, let's see. 64.6% of ICU beds are being used, 1.7% for COVID, 0.8% is for influenza. Inpatient bed usage is at 69.5%, COVID is at 2.1%, and influenza is at 0.8% of the usage. And finally, let's go somewhere down south. How about we take a look at Alabama and see what's going on there? In Alabama, 79.8% of all beds are being used, 2.6% are for COVID, 1.1% is for influenza. And what's the ICU situation there? 79.9%. That's quite a bit. 3.2% is for COVID, 2.1% for influenza. So respiratory viruses is making up 5.3% of your ICU usage. Yikes, that's not too good. All right, let's take a look at a few wastewater sites. I thought we would take a look at Louisville, Kentucky today. Let's see what's going on there. Louisville, Kentucky at this time, high for COVID, and I should mention 423,913 is the population of this wastewater site, so it is high for COVID at this time. RSV, it's still coming up high, but it is dropping ever so slightly. Little bump on a recent update, but it is dropping. Influenza A, high but trending down. Influenza B, high but trending down. But look at this, norovirus, since December, right on through to about the beginning of the year, it was rising. Then it flattened out. Then since January 29th, norovirus has really had a run upward. Again, it's concerning to see norovirus rise as much as it is in the United States. Hepatitis A, there have been some detections of that. Mpox, not doing too bad at this time. No detections of that. Let's take a look at a couple more wastewater sites. How about we come down here to, let's see what's going on in Alabama. How about we go down to Valley Creek, which is just southwest of the Birmingham, Alabama area. This is 225,000 population. Big time wastewater site. Look at this. COVID. Yikes. Yet again, your wastewater is starting to go up. See? This is why you don't follow the national trend. Pay attention to what is happening in your community. If you lived in this area, you would follow the national trend. You would be misled. Your local wastewater site, just outside of Birmingham, Alabama, it's starting to go upward. This is why you pay attention to what's going on in your community. And this goes for any of these viruses. So COVID here, since February 9th, it's been having a run upward. RSV at this time is dropping there. Influenza's high but dropping. Influenza B is high but dropping. And I should mention, COVID is still in the high category for you. Norovirus, it's rising ever so slightly at this time. And there have been some detections of hepatitis A, but not terribly concerning, and no detections of Mpox at this time. All right, let's do yet another wastewater site. How about we come to the Dallas area? Let's see, and let's go south side. South side wastewater. This is all part of Dallas. Let's see what is going on here. COVID. It's not following the national trend. The most recent update, it's gone upward a little bit. From February 13th to February 21st, it has had an increase. It's still medium. Wastewater size is 421,700 population. RSV, flat but medium. Influenza A is downward. Influenza B, flat, ever so slightly rising, not terribly concerning. HMPV is not concerning. Norovirus is medium but flat at this time. No hepatitis A and no Mpox at this time. Alrighty, continuing on. We learned this week that Walgreens went to 24.1%. That was down 2%. We also learned this week that deaths for COVID, they're rising in Kentucky. They're rising in Oklahoma. They're rising significantly now in Puerto Rico. Yeah, absolute difference from prior week. 3.2% change from prior week. 84.2% higher. Yikes, that's not good to see. And there are a few other states mixed in between that are seeing rises. One of them is Texas. Mississippi is seeing a rise for COVID deaths. There's also a rise for COVID deaths in Georgia. Yes, sprinkled throughout the country, there are states that are still seeing rises. In the hospital this past week, 18,977 admissions. We will get the BNO numbers tonight, and we'll include that into tomorrow's pandemic update. Hospital admissions are down 5.7% this week. Taking a look at epidemic status, we learned that it is still growing in some areas for both flu and COVID, and some places are declining or likely declining at this time as well. JN.1 is still 26.4%. And taking a look at influenza, Ohio is now up to very high. If they go one step higher, that would be the highest shade color on the map. It's possible that happens because it is still rising there. Also, Washington, D.C., District of Columbia, is not too far off now from that highest shade of purple as well. They're in that maroon category, very high. So there is still a lot of flu transmission going on throughout the country. California, you're now down to the minimal level, as is Montana, but now we see Washington still in the low category, low in Oregon, getting close to that moderate stage, and you are moderate in Arizona, low in Nevada, Pennsylvania. Look at this, my state is low at this time, and Florida is now down to the moderate category, and we do again, Wyoming, look at this, very high level, and we do have a lot of places in between that are still moderate to high flu levels at this time. Not many hospitals reported out of New Jersey today. Yeah, just 56 out of 70. No point in going through these numbers. No update from New York, and anything else doesn't update today. I did want to show you this. Hospitalizations in Chicago, they were up ever so slightly this week. Cases were down. Deaths were up slightly. Emergency room visits were also up, but we have to backtrack ourselves here. Let's go back to CDC. Let's go to the CDC wastewater page. You know, this is the page we look at if you're new here. There's various different colors. The reds are being bad. The orange is bad. And when we go to Chicago area, which I do want to do, you can see we're seeing a mixed picture here. From cases being down, but at the same time, we come to this red site right here. This is Cook County. On the most recent update, look at this. It is going up for wastewater. So I suspect if they did more testing in this area, and again, this is a huge wastewater site, 1.1 million people. If they did more testing, I think we would have seen cases up. Because wastewater says, no, your cases are actually rising. The hospital situation, as we go back here, slightly up, emergency department visits slightly up, indicates there likely is a somewhat of a rise in Chicago. I don't think it's going to be a long-term wave. I think it's just a bump in the road, and then you'll go down again. But hey, it's something to take note of. Again, you're having a little bump in the road. It's not following the national trend. National trend did have a bump in the road. Now it's dropping, but Chicago's having that bump, and it's just a little bit delayed. Again, this is why you need to pay close attention to the resources of your local community, because that really, when it comes down to you doing a risk assessment on is it safe in your area, that's what it really comes down to. What's going on in your local community, not the national trend. Alrighty, folks, I think we covered a ton today. We've gone over 22 minutes, almost 23 minutes. That does it for today's pandemic update. If you enjoyed this update, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. We will have the Monday edition of the pandemic update sometime tomorrow. I don't know if it's going to be an at-home one or out in the wild. It may be an out in the wild update. We are going to have at least one of those this week, so look for that this week. They're always fun. You know, I usually end up doing a discussion, doing that on something that's bothering me or a popular topic in the world of all these viruses. So I'll see you again next time. Thumbs up, subscribe, share these videos, and have a fantastic Sunday. But do it one way. Do it safely. I don't want to hear you putting comments down below. Well, we had such and such event this weekend, and now we tested positive. No, no, it's still not safe. We're still well too high with transmission in this wave. It needs to come down a lot further before it's safe to do that stuff again. I'll see you all tomorrow. Have a fantastic Sunday afternoon. Stay safe, everyone. Thanks for watching.